health systems are in crisis because of COVID-19, or hospitals are no busier and deaths are no higher than average. Can both of these be true at once? Also, Brexit is finally done, the world begins vaccinating people too slowly for some, and the US election nears the final chapter. My name's Mallen Baker, this is the Mallen Baker Show. All those countries leading on vaccinations across the world, doing so against the backdrop of seeing surges in cases that are being matched by growth in COVID-related deaths. Having been told all summer that we were seeing a second wave, even though there was ample evidence at the time it was purely the result of increased testing, nobody's now talking about that, because this is the actual second wave. And the narrative from the mainstream sources and the lockdown skeptics has now started to diverge to the point where there is real confusion. How can these two versions of reality be true at once? On the one hand, we have a number of areas where the health services are reporting real distress, with ICU facilities close to being overwhelmed, health workers on the verge of burnout. In the UK, there were reported 23,771 coronavirus patients being treated, compared with a peak of 21,683 in April. Whereas in April, many other NHS services were temporarily halted to focus purely on COVID-19, those services are being kept going at this time, so the ability to transfer staff from one function to another is reduced. And this is particularly true in London and in parts of the South East, with critical care systems that used to require one nurse per one patient now having to run 1 to 3 systems. For instance, Queen's Hospital in Romford, which has 28 critical care nurses to care for 68 patients. Queen's also saw doctors approve reduced amounts of oxygen provided per patient to try to cope with the high level of demand. Services in Essex and Buckinghamshire declared major incidents. After a period where the non-occupancy of London's emergency Nightingale Hospital, created with great fanfare at the height of the first wave but rarely utilised, reports are now that it's being brought back into operational capacity to begin taking on overflow patients. On the other hand, you have lockdown skeptics showing data suggesting that actually ICU occupancy is always a problem at this time of year. The figures are no worse this year than previous times, therefore it's just that people are focusing on the situation, whereas normally they treat it a lot more casually. They admit that the latest figures in London, the South East and the East of England see higher ICU occupancy than total capacity the previous year, but in other regions it was lower, so overall not much change. An argument you might reflect on is relatively small comfort if you're a health worker in one of those 3 regions. They also show that critical care occupancy was below the December average for the last 3 years, except for the East of England. On Toby Young's Lockdown Skeptics website, they conclude this: the fact that capacity hasn't been exceeded in the vast majority of areas suggests that, contrary to the impression given by the BBC, the NHS isn't at breaking point. And the killer is to show how every year at this time there are stories showing NHS ICU beds in crisis as the NHS struggles to cope with winter illnesses. See, they say, this is absolutely normal. It's just that this year we're paying attention to it because of COVID. You can add to that the contextual information about annual mortality rates. For many countries, states or regions across the world, the excess mortality rate didn't exceed the average for recent years, or didn't by much in some places. So no more deaths than usual, no more ICU occupancy than usual. It's all just hysteria, overreaction and nonsense. Well, assuming we're interested in the truth, and not just rooting for one version of reality that suits us the best, what do we make of this? First of all, I see real distress, both in some of the health workers talking in public and indeed amongst my own circle of contacts, with several people burned out and looking to get out of the health service. And that isn't tied just to one country, where you could conclude that it would be down to poor management in that country, but across all the countries that have been seeing the highest figures. Now, I'm a big fan of the Lockdown Skeptics website, and some of the smart challenges to policy and understanding of COVID-19 of the last years have come from there. But dismissing all that feedback with a couple of graphs and declaring all risk of a crisis to be proven wrong is cold, and a clear example of how data can be misused to hide a reality, not to reveal one. But the data shown on the graphs is correct as far as I'm aware. So how can these two things be true at once? There are certain factors clearly at play. One of the key constraints in capacity isn't ICU beds, but staff. We came into this year with the NHS having 43,000 unfilled vacancies for nurses. And that wasn't new. A similar shortfall has been reported over the last few years. But it represents a capacity issue regardless. At the same time, the first wave of the virus took a heavy toll on the staff. Even before the first wave was finished back in April, a British Medical Association survey found that 44% of doctors felt they were suffering from depression, anxiety, stress or burnout. In August, a poll of health workers by the NHS Confederation's Health and Care Women Leaders Network reported that 72% felt their job was having a negative impact on their mental well-being as a result of COVID, largely due to the constant anxiety that they would catch the disease themselves. More than half said their physical health had declined, citing overtiredness and exhaustion due to increased working hours. On average, staff have taken on additional 11 hours per week since the start of the pandemic. These are the sorts of factors that those graphs do not capture. The fact that a higher percentage of the workforce are exhausted or worse. The fact that during the COVID waves, a higher percentage of staff are off ill, putting more pressure on those that remain. The fact that all the requirements for working with heavy PPE and systems to try to prevent the spread within the hospitals of COVID means that providing the same services this year as you did last year takes a lot more effort. And then when it comes to average mortality figures, you also have to ask the question, and I asked the question, I don't know the answer, how well spread out were previous mortalities through other departments and other locations, which this year are all being channeled and concentrated into one place for COVID ICU wards. It makes a huge difference to the system's ability to cope, but doesn't necessarily show up in the statistics the way that they're currently being reported. I've seen some people asking how can it be, since we had nearly 6 months since the first wave, that the NHS is still not able to cope with the second? Isn't it just incompetence not to have built up capacity in the meantime? Well, look, there's always scope for identifying incompetence. I go with that, absolutely. But there's a strong streak as well of magical thinking in that criticism. If your system is seriously depleted after a first strike, it may be no simple matter to just completely reform and renew it to meet a second one. And remember, no country is ever going to carry boundless capacity in its health service, able to simply absorb the pressures of a pandemic with no strain whatsoever. Because as it is, no country can afford to treat every single ailment of every single person, even in the good times. There are always hard choices to be made. So no system is going to plan to run with redundant capacity just so that it can be used for out-of-the-ordinary events. And none of this really gets helped by those who spread actual disinformation. People creeping into empty parts of hospitals and putting video on social media claiming it's the ICU ward or A&E and saying it's all a hoax. There are some parts of the country where COVID infections are a lot lower than elsewhere. There is no hospital with an empty A&E, COVID or not. Those videos are always fake. But these things have consequences. In Italy, a nurse who was the first person to get vaccinated there, Claudia Alivernini, received tons of abuse from anti-vaxxers and others, sending her messages like, "Now let's see when you die." As I've said before, it's one thing to go after the likes of Bill Gates or Klaus Schwab, people who are big enough to shrug off your abuse. But regardless of what you think about public policy on all this, and I've had plenty to say on that score here, you're kind of a dick if you go to hurl abuse to ordinary stressed out people who are just doing their job. We ought to be able to debate a position while retaining compassion and human decency. And really, it would be good if those people that had been hurling that abuse could make a New Year resolution to do that in 2021. Now, in a minute, we'll get on to a roundup of some of the other news this week. But first, On this channel, I place a lot of store on what's supported by the scientific evidence. The gold standard is the peer-reviewed research. There's a huge difference between the campaigners on both extremes of any issue, who will usually be quoting the opinions of individual scientists, versus those interested in the truth, who look to the evidence represented by high-quality research, not just opinion. But is there a crisis in the science right now? Can we rely on it as much as we would want to? Many people have been speaking for years about a replicability crisis in science, where, particularly in certain fields, the results shown in highly influential papers have subsequently turned out to be unreproducible. Estimates for the numbers of papers that are affected by this can go extremely high. So what's the story? What's at the heart of the replication crisis? And what does it mean for how much we can look to the evidence to back up our understanding of how the world works? This is one of the most important questions facing us, because so many other things fall over if you can't rely on the integrity of the science. And this may be a topic we have to come back to several times, but I'll be taking a first look at this in the video that will be launched on Monday next week. It's Monday, the 4th of January at 7 p.m. UK time. See you there. It's 2021. I expect you knew that. But the key thing is that the sky hasn't fallen in. And that's big news for some people, because it marked the end of the Brexit transition period and the first day of a new situation. As I predicted, and I mean it wasn't much of a prediction, more of a statement of the bleeding obvious, the trade deal went through Parliament with a huge majority. Only the Scottish Nationalist Party, which had been saying for months how a no-deal outcome would be a disaster for the country, well, they voted for no deal just to show something. And various people were glad, in spite of all the stuff going on, and others were wailing, and there was the gnashing of teeth, including by the Mayor of London, who pointedly included EU colours in the London New Year display, along with references to Black Lives Matter. So someone hoping for a very woke New Year there. Some were quick to criticise him for politicising a national celebration for the New Year. I think I would join that group, to be honest. But what's done is done. We will hear the word Brexit through 2021 only in the same way you get small aftershocks after a big earthquake. After 4 years of being obsessed on the subject, we can now put that behind us and fight like ferrets in a sack over other things instead. But there are limits anyway to how new the new year can feel when we're facing a long, hard COVID winter. In the UK, the Oxford vaccine received approval, leading the Health Secretary Matt Hancock to suggest that this would mean freedom by Easter. At least 2 million people a week are expected to be vaccinated, with a number to reach almost 30 million, just under half the total population, by the end of May. Although the government has a pattern of overpromising and under-delivering, it has been calculated that this is an achievable goal, if executed well, which is kind of a big if. For once, the operation has pushed Britain into the front rank of countries in an aspect of responding to the pandemic, with many other countries struggling to mobilise their own efforts. As mentioned last week, Germans are particularly angered by some of the comparisons, with 640,000 people having received the first jab in Israel, compared with only 78,000 in Germany. It hasn't been helped by the fact that doses have been slow to be distributed by central government. The health minister for Berlin, Dilek Kalaisi, said that a promised delivery of 30,000 doses for the beginning of January had been cancelled. Germany does expect, in due course, to receive more than 130 million doses, enough for everyone that wants one. But that could be slow to come. The government promises it should be by the summer, which people are contrasting with the UK's target of the start of spring. And as a member of the EU-wide scheme for buying vaccine, it's actually forbidden from negotiating independently with vaccine producers. Still, at least it's doing better than France. At the point where Germany had vaccinated 40,000 people, France had managed just 119. One of the reasons for that seems to be bureaucracy. France is the only country where written consent is required before vaccinations can be administered. Given that surveys have suggested that half of French people were inclined to refuse a vaccine and only 13% were definitely intending to get it, the slow and measured start reflects the interest by the authorities not to make any missteps that would make it harder to win people over, which is nice. But it's logically impossible to avoid. I give you this prediction now, and I almost never predict things in these videos. When you roll out a massive vaccination program to millions of people, a tiny number will die soon after being vaccinated, because a tiny number of that larger population die all the time. But the politically motivated will soon be seizing on those and publicising them, claiming that the outcomes must have been caused by the vaccine. It's guaranteed. Whether they gain traction or not is less certain, but it is statistically one of the most safe predictions you can make. Now, the United States is also seeing complaints about slow rollout of a vaccine, a situation that predictably enough President Trump has blamed on the states and the Democrats have blamed on, yes, President Trump. The government had predicted that 20 million people would have had their first shot by the end of the year, while in practice it has been just a fraction of that number. Administration officials said that despite the slow start, there would be a massive scale-up through January, reaching 30 million and then getting to 50 million in February. Now, that probably doesn't get helped much by the admission by the top pandemic figure, Anthony Fauci, that he deliberately misled the public on needed vaccination rates. In an interview with the New York Times, he confessed that he'd originally said that 60 to 70% of Americans would need a vaccine, but he pushed that number up in later statements to 90% based on polling data, not scientific evidence. He said this: "When polls said that only about half of all Americans would take a vaccine, I was saying herd immunity would take 70 to 75%. Then, when newer surveys said 60% or more would take it, I thought I can nudge this up a bit, so I went to 80-85. Fauci admitted that we don't really know what the real number is, but he made an estimate based on known figures for measles. The news media, most relied on by exactly the community most likely to turn against vaccination, the likes of Fox News and so on, covered Fauci's admission extensively, which was entirely predictable. So how you think you're nudging the figures up by displaying your readiness to promote misinformation in order to manipulate people, that's something that I'm missing. More likely, it adds to the growing distrust of experts, most of whom are not politicised in how they do their job, but all of whom get tarred with that brush when high-profile figures do dumb things. And speaking of high-profile figures who do dumb things, the moves by Trump loyalists to demand loyalty at the very end, regardless of the consequences, is continuing to play out in the Senate. Senator Josh Hawley announced that he would object to Congress's certification of the Electoral College results on the 6th of January, which is the final procedural step in confirming Biden as the next president. It's a move that has almost zero chance of success in overturning the election result. But what it will do is force Republicans to declare which of them are going to go to the wire supporting the president and which of them won't, with the recriminations expected to follow. The Wall Street Journal editorial board described it as a kamikaze mission, an assault on the democratic process that would end up hurting the Republicans whichever way it played out. Either way, a large demonstration of Trump supporters is expected on the day, so no doubt there will be more drama to come before Inauguration Day later in the month. And all wrapped up in with that will be the two runoff Senate elections in Georgia, the outcome of which will determine the balance of power on the Senate. Things change significantly for the Biden administration if they can win those seats. It's an open question whether the party division created by what seems to be a futile attempt to overturn the presidential result will mean that the Republicans end up losing control of the Senate and handing significantly more power to Biden for at least the next couple of years. This is the week we'll find out. Now, in a moment, we'll move on to replying to comments and the final thought for the week. But first, this week we learned that trials are going ahead to explore the practicality of solar dimming, dispersing material into the atmosphere designed to reflect back a percentage of sunlight to help deal with global warming. The exploratory pilot is being supported by Bill Gates, because of course it is. Now, I suspect I am with the vast majority of people who would see the headline for this one and immediately think, that is totally bonkers. How could anyone go along with such a thing? Let me check. Is it April the 1st? No, can't be, because we just had New Year. But Bill Gates is a smart guy. I mean, I know some people in the comment section think he's a lizard or something. But the question is, am I missing something? What is the actual case for doing this? What is the potential upside? And indeed, the potential downside. What's the likelihood it could ever get to the stage where it would actually be put into action? I figured I should probably find out. And I'll be sharing the results of that inquiry with you in the video to go live Wednesday next week at 7 p.m. UK time. Join me then. 2 comments after this week's video on things we learned. The pandemic has accelerated by several years China's strategy to displace the United States. I'm not prone to conspiracy theories, but you'd think another pandemic, perhaps a deadlier one, would really finish off the West and elevate China once and for all. We in the West would be foolish not to consider that a very real threat. I agree we should certainly be alert to the idea of the next pandemic. But out of the various threats that we face from China, which are real and immediate, I can't get on board with the conspiracies suggesting that it would ever make sense for China, or indeed anyone else, to use a pandemic as a weapon of war. You can't train a virus to attack only the enemy. The fact that China fended off the first wave of coronavirus to a point doesn't make them immune to the damage. And bear in mind that, like all authoritarian governments, they won't tell the exact truth on the figures that they already sustained. And, it's not even over yet. Some governments, like Germany and South Korea, who did very well first time around, had it all catch up with them eventually. And that can happen to China as well. Now, okay, China can physically lock its people up in a way that democracies never could or would. So you could argue they will avoid the worst of the damage. Well, let's see. I wouldn't be at all surprised if they didn't end up having some serious problems at some point in 2021 with the current virus. Another comment on the same video. Very good, although I don't like all the talk about conspiracy theories. This seems to have become the catch-all description of anyone who disagrees with the mainstream view. Anyone who thinks for themselves has been downgraded from skeptic to denier to conspiracy theorist. What's left for anyone who can't see the emperor's new clothes? I take the point, but I respectfully disagree. Disagreeing with a mainstream view is something that I find interesting. The debates I promote here are ones that present evidence. Take this episode, for instance, looking at the evidence that the NHS is in crisis, the mainstream view, versus evidence suggesting it isn't, or at least shouldn't be. And we're able to evaluate the arguments and the supporting evidence and have a sensible critical discussion. At no point do we have to speculate about people's motives. The evidence we have is all entirely compatible with everyone just trying to do their best with what's in front of them. At no point do we theorise about links to someone's master plan. This is the difference between sceptical thinking and conspiracy theories. Evidence, not filling in the gaps with fantastical theories, constantly checking and questioning your own assumptions. One is excellent skeptical practice. Indeed, it's kind of a definition of the scientific process. But the other is following a story which has no evidence because certain extremely loose correlations are all you need to conclude that people are up to something. And all you have to do to make the point is to shout, "Wake up, sheeple!" or something similarly silly. It's the new year. I may have mentioned that already. The time of year where lots of people make resolutions that in their heart of hearts they know they will have broken before January is finished. And when a smaller group of other people reevaluate their top priorities and set their goals for the year, that group is worth joining. I used to work for business in the community, which would get business leaders involved with supporting their local communities, which is easier than you might think. because business leaders have often had a culture of wanting to give something back. You don't get to a successful position without the goodwill and support of mentors and supporters along the way. Anyway, the point is that back in the late 1990s, I remember an event for a scheme that BITC was running to get business leaders to mentor head teachers. At that point, head teachers were being asked to run their schools like a business for the first time. They knew a huge amount about teaching, but at that point, they didn't necessarily know much about running a business-like organisation. There was one head teacher who spoke at this event, and his story stood out for me. He talked about the first meeting that he had with his new business mentor. The mentor, let's call him Bill, asked, "So what's your top priority for the coming year?" And the head teacher, let's call him Edward, thought about it for a minute and said, well, it would have to be to raise educational standards. That's what I care about. Very interesting. So they chatted a little bit more, and then Bill asked him to share what he had in his diary for the coming week. And there was all the various committee meetings and the administration things, some direct teaching, all sorts. But when he'd finished, Bill asked this: how come none of those items in your diary are about raising educational standards? And Edward started making all the excuses about how little time he had available, because look at the busy schedule. And Bill stopped him and said, but you told me that this was your top priority. If you don't make time for your top priority, then it isn't your top priority. Edward told us that one challenge, this realization that he needed to organise his time to reflect his actual priorities, transformed how he worked. And this is why business leadership books go on so much about time management. It's not just about being efficient, not wasting time. It's about ensuring that your use of time is aligned to what you want to achieve in business or indeed in life. The difference between the people who become the most successful is that they know what their long-term goals are, and they can break those down to shorter-term goals of how to get there. And then they organise themselves to make sure they prioritise those things. Personally, I don't think there's anybody in business, in politics, in any other career whatsoever, who doesn't benefit from doing this. Maybe you do it already. If not, you could do a lot worse than make 2021 the year when you start. Just a thought. One of my resolutions for 2021 is to go all in on this channel, to make videos that are useful, challenging, interesting and worthwhile. I'm only able to contemplate doing that because of the support of the good people who signed up to support it on Patreon. In 2021, I want to begin giving some real value back to that community with Patreon-only content to recognise how huge a difference your contribution makes. If you would like to add your support to the independent, fact-focused and non-ideological content that I aim to produce here, please go to patreon.com/Mallen Baker. Either way, have a great week and a great 2021. My name is Mallen Baker. This is The Mallen Baker Show.